I guess my expectations was, you know, a very low income, Indigenous predominant community. And so you have a lot of preconceived ideas about what that looks like. And, you know, there's concerns about violence and alcoholism and safety. And that really wasn't borne out. Those things exist. And certainly in the emergency department, that's where you see them. And you know, I felt totally safe walking around the town at night and going for runs and going to the shops. And yeah, it was kind of a nice little, you know, rural Australian town in some aspects. So the breadth of medicine that you can practice in a place like that is huge. You know, you get an incredible array of presentation from pediatrics to aged care, you know, through the ED. We get cancer medicine, we get lots of trauma and mental health. There's lots of internal medicine working on the wards. We had, you know, very interesting and difficult cases that we were working through, you know, consulting with physicians in Broome and Perth. So, you know, we had children as inpatients when we were there as well. We had a bit of a rotavirus outbreak. And so lots of dehydrated sick kids on the ward being managed. It's a fantastically broad array of things that you can practice. And I think it's incredibly well supported. So, you know, if you're feeling out of your depth, certainly with some of the kids as a GP, you don't deal with kids who are that sick as an inpatient. And so chatting with pediatricians who do that every day, and they're all on call 24/7, you know, numbers are on the wall in every room. So it's really, really reassuring that you can go, look, this could be a silly question, but it's a kid, help me out. And they're every single person I rang was amazing. So really nice to feel that support. Awareness. There are Aboriginal liaison officers throughout the hospital, and they're really helpful for various things.
Yeah,
I found personally that most of the time a really sort of open and honest conversation, usually starting with my ignorance about certain things and apologising, but expressing a desire that they're healthy, prompted people to kind of happily educate me with a little pat on the head and say, look, this isn't how it works, mate. Go this way. So, you know, I think I kind of managed it mostly that way, but everyone was really cool. And interestingly, I think with the kids, we see parenting in Indigenous Australian communities is much more communal. It's much more of a village effort. And so it's auntie and grandma and mum and dad, but not anyone would sit with the baby, you know, in hospital all day, every day for, you know, 3 days. That it's just not how it rolls out.
Yeah.
There were some differences like that needed to be negotiated. I think, you know, if you're interested in closing the gap in Australia, this is where the gap is. So even small things in this location, you know, is going to make a big difference. Certainly we had people who had missed dialysis and, you know, or who were septic for a variety of reasons. And, you know, so we absolutely changed trajectories and saved lives with simple stuff, fluids and antibiotics. There's an enormous amount of good to be done, and we need to be someone who's, you know, as a doctor, if the bed needs to be made and the nurses are busy, you make the bed. You know, don't get upset that there's no, you know, it's not like the tertiary centres. And I think you just got to muck in and get stuff done. And, you know, sometimes you have to walk down the street to find where the patient's gone, and they'll be, you know, down the road or under a tree or and chatting to them outside. And, you know, I think just bending to the community and not asking the locals to bend to how you normally do things is probably the best way to think about it. But there's a big jetty and there's always people fishing off the jetty, and a couple of the local people are always getting barramundi and sort of sharing, you know, fillets of barramundi around the hospital. So it's pretty good. I like an adventure and do, you know, sporting stuff that's adventurous, and so that's probably why this type of work appeals to me. But the more of this I do, the more I want to do of it, because you know, I come back from the Kimberley thinking maybe I'll go and do, you know, emergency training, or maybe I'll go and do the anaesthetics training. And so there's loads of pathways in rural generalism that you can follow. Yeah, it certainly inspires me to do this work, as exhausting as it can be. I think I enjoy looking after kids more than adults, which probably tells me where I should be going in terms of further training. But seeing the little kids get better and they come in really flat and floppy, and then the next day, you know, judging whether they're safe for discharge, and they're tearing up and down the hallway, and terribly cute kids, you know, running in and out. This is a sign that they're discharge ready. But I think you know, kids have hopefully 80 years to live. Maybe Indigenous kids don't have that long, but you know, that's something that we can, again, we want to move that needle a long way, and hopefully helping their sort of health trajectory be on a better path